regulatory training, control and semi-controlled medication. Hi, I'm Hala Al-Qut, pharmacist at DBRC. With our mini training today, we will come to know some of the definition and classification of medication at UAE, prescribing and dispensing of controlled and semi-controlled medication, what is the storage requirement, what is the administration regulation. Drugs classification as per UAE Ministry of Health and Prevention is either OTC, over-the-counter medication like Panadol, Strepsils, or prescription drugs. Prescription drugs either general prescription medication or controlled drugs. So when we say controlled drugs, we have subcategories: semi-controlled drugs, full controlled drugs, and narcotics. Narcotics, they have a different regulation, and mainly we depend on these paper prescriptions. For control and semi-controlled drugs, they are following the same regulation except for duration of prescription. Controlled drug is a medicine that contains an active ingredient listed or a medicine that has been assessed as having a significant potential for abuse or could be diverted for illegal use. Its schedule, as mentioned in the Federal Law Number 14 of 1995 on the countermeasures against narcotic drugs and psychotropic substances, and its amendments according to the aforementioned Cabinet Decree Number 38 of 2015. Semi-controlled drugs is the drugs not listed within the schedule attached to the Federal Law Number 14, but they have been classified by the Drug Registration Committee of MOHAB, Ministry of Health and Prevention, as semi-controlled drugs, and they have contained the following: either medications that have medical benefits, but with long-term use in high doses or use with other substances that might lead to habituation and addiction, or substances that have potential serious side effects. So, as per DHA and DBRC followed policy, all processes related to controlled and semi-controlled drugs should be defined and comply with the applicable laws and regulation of MOH. All pharmacists, physicians, registered nurses will be informed as to the procedure which ensures safe and secure storage of controlled drugs. All orders of controlled and semi-controlled drugs shall be prescribed in Salama, and the duration of prescribing semi-controlled and controlled drugs will be as the following. For controlled drugs, GP can prescribe up to 3 days, specialists up to 15 days, except for psychiatrists and neurologists can prescribe up to 30 days. Consultant can prescribe controlled drugs up to 30 days. For semi-controlled drugs, GP can prescribe up to 30 days. Specialists can prescribe up to 60 days, except psychiatrists and neurologists can prescribe up to 90 days. And for consultants, they can prescribe up to 90 days. So, for prescribing and dispensing, physician and pharmacist will use Salama as it is already integrated with OpenJet and HealthPorter for dispensing, prescribing and dispensing controlled and semi-controlled drugs. Pharmacists shall collect the patient's Emirates ID, then select the prescription and enter the dispensing quantity. Dispense drugs to the patient with clear instructions and register the dispensed quantity on the register file. Storage. All semi-controlled and controlled drugs are stored in a locked metallic cabinet, except for the cold chain items can be kept in a locked refrigerator. Administration. Before a narcotic or controlled drug can be administered, there must be a valid prescription completed by the physician. Administration of controlled drugs require an independent double check and a documentation of the second checker on the MAR as witnessed by medication administration. If the dose is to be given via infusion, the second checker must witness the start of the infusion. In case it was not given or was wasted or refused, document the reason in the remarks column of the drug register and sign it. Here we are some references. The first one especially is for the travelers to know what is the medication allowed to enter UAE, and Ministry Decree number 888 of 2016, and Pharmacy Standards Dubai Healthcare City Authority guidelines. And thank you.